Now to the pandemic, a couple of things to bring you up to date on. Manitoba is reporting another spike in new cases. There were 110 positive cases in the past 24 hours in Manitoba. Outbreaks have been declared at an elementary school and in 3 personal care homes in Winnipeg. Manitoba still has the highest number of active cases per capita in Canada. In Quebec, 877 new cases were reported today. Tight restrictions are already in place in Quebec City and Montreal, and now the city of Joliet and surrounding areas will move into the red zone as well on Friday. Cases are still on the rise in parts of Ontario, too. More than 800 new infections were reported today. At the same time, testing numbers have dropped. Just over 24,000 tests were processed in the last 24 hours, the fewest in a single day since early September. People had been waiting up to a week for their test results. Today, Premier Doug Ford claimed that backlog has been cleared.
We had a little blip there for a week, 2 weeks. Now it's all caught up, so anyone who's going to get a test, you can get a result almost immediately, a day later, 2 days later.
There is another problem that is putting a strain on COVID-19 testing in Canada. As our chief investigative correspondent Carolyn Jarvis reports, a small but crucial piece of equipment is in short supply.
Pipette tips.
Pipette tips.
Pipette tips.
Here's something no one expected to be talking about 7 months ago. Pipette tips. A tiny piece of plastic that's crucial in a COVID-19 test, and the latest part of the supply chain that's nearly impossible to get.
We thought that supply chain was secure, and lo and behold, our delivery doesn't show up.
I never thought in a million years I would be trying to find pipette tips from, any supplier that I can.
And it's not just pipette tips. Any sort of plastic used in COVID testing, referred to as consumables, is running dangerously short. This document, obtained by Global News, was put out by Ontario Health in the last week and lists 15 different types of plastics used by labs that are in short supply, many of them at high risk. We contacted the companies listed, and only one of them responded, saying because of American demand, getting any product out of the U.S. is impossible, and they're now looking to China.
Like all of that back corner with the yellow tags, those are all pipette tips.
This never-before-seen footage taken inside the shared hospital lab at Toronto's Sunnybrook Health Sciences Centre shows a stockpile of these scarce plastics.
If you run out of one piece of your algorithm, the whole lab comes to a halt.
At St. Joseph's Hospital in Hamilton, a former office is now a secret storage closet. So this is gold.
This is gold.
And these boxes will only last 2 weeks.
The fact that we even have to lock up our supplies and gloves and keep them in an area so that other people don't know about it, it's unbelievable.
Some distribution companies have now taken to rationing items.
And that's frustrating to just see the equipment sit there idle.
For the people trying to figure out how to make do without, the pressure is crushing.
I want to run out of the building screaming, and I have to tell you, our laboratory technologists are having moments where they have to stop and cry.
To survive, labs that have are sharing with those that don't. And if a lab still can't process tests, samples are being shipped elsewhere.
This is not a normal procedure. This is full-time crisis, wartime mode.
The question many are now asking is why hasn't Canada secured a domestic supply chain for its labs, like it did with PPE? The federal government says it has signed contracts with companies to secure some supplies in Canada, but the bottom line is labs are still struggling. Donna?
Carolyn Jarvis in Toronto, thanks.